So, how do you actually do evidence-based practice? Let me break it down into 5 steps. Ask a question. Frame the client's problem as a clear, answerable question. For instance, what is the most effective treatment for panic disorder? Acquire the evidence. Use resources like PubMed, PsycInfo, or Division 12's website to find interventions supported by research. Appraise the evidence. Not all studies are created equal. Look for sample sizes, methodologies, and relevance to your client's situation. Apply the evidence. Here's where your clinical expertise shines. Adapt the evidence to fit your client's unique needs and preferences. Assess and adjust. Therapy isn't static. Monitor your client's progress and be prepared to pivot when necessary. EBP is not a rigid protocol. It's a living, breathing process that evolves with each session, each client, and each new piece of research. Let's talk specifics. Some of the most well-known evidence-based treatments include cognitive behavioral therapy, CBT, a powerhouse for treating anxiety, depression, and trauma; dialectical behavior therapy, DBT, highly effective for clients with emotion regulation difficulties; motivational interviewing, MI, a go-to for addressing ambivalence in substance use and behavior change; exposure therapy, the gold standard for phobias and PTSD. What makes these interventions stand out isn't just that they're effective, it's that they've been studied, scrutinized, and validated across diverse populations. Now let's get real for a moment. Implementing EBP isn't always easy, especially in private practice. Time constraints. It can be hard to stay updated on the latest research. Complex cases. Real-world clients often don't fit neatly into a single diagnostic category or treatment manual. Resistance. Both clinicians and clients may hesitate to try new approaches, especially when they challenge long-standing habits. But here's the thing. Embracing EBP isn't about being perfect. It's about being intentional. Even small steps, like incorporating one evidence-based technique or attending a workshop, can have a ripple effect on your practice. Let's take a moment to dream. Imagine a world where every clinician is not only fluent in evidence-based practices, but also contributing to the body of research, collecting data, sharing insights, and refining interventions. This is the future of psychology. And as you sit here today, you're not just students or interns. You're the future architects of our field. So, what's next? How can you start building an evidence-based foundation in your practice? Stay curious. Make a habit of reading journals, attending conferences, and joining professional organizations. Practice humility. Be open to learning, even when it challenges your assumptions. Engage with clients. Remember, EBP is a partnership. Listen to your clients and let their voices guide your work. And finally, join communities that share your commitment to evidence-based care.